So it was on my day off, and I was taking my son Jackson to the park, and of course Betty comes along, and I literally threw the ball, as I always do, and the second time I threw it, she yelped out in pain, and Betty started dragging her legs towards me. Betty's got you. The fact that she'd gone from walking perfectly well to being paralysed, I knew that this was not your average injury. So I literally scooped her up, ran home with the baby, called Zoe. She ran back. Shush, honey, shush.
It's all right, baby. Daddy's gonna try and help you.
There's nothing on this right side at all.
Absolutely nothing, is there? She's not trying on that side at all, huh?
No.
It's all right, all right, all right, all right, all right.
Okay. Yeah, just let it. So straight away, examined her, and I could tell that both of her back legs are paralysed, and this was a spinal injury.
Get her over to Michael.
Yeah.
Despite already being given pain relief, the traumatised terrier is still crying out for help from her best friend.
Take you to Uncle Michael's house.
Come on, let's get it, go. The sooner we get it, the better.
Scott is about to take Betty to specialist orthopaedic surgeon Michael Hamilton to find out if anything can be done.
I need to go and see Michael. Yeah, just see a mate. Who knows more about this stuff than me. Just to kind of, yeah, just give me the honest steer. Because my heart is really in my head right now. Come on, baby. Come on. Be brave.
Okay, you guys get the stuff for the car, because she needs to get going.
Okay.
Better. Let me love you. Call me, won't you? Okay, as soon as you speak to Michael, call me.
Okay. See ya.
Drive safe, bye-bye.
Thanks. Good girl. Stay, baby. Stay.
Scott's now arrived at the Cherry Tree Veterinary Practice. His longtime friend, specialist orthopaedic surgeon Michael Hamilton, is waiting to examine Betty.
Hi, mate.
Hey, mate. Right, okay. Hey, Betty. Right, let's get you looked up. Come on in, honey.
The little terrier fell down in the park, and her back legs are now paralysed.
It was kind of weird to see Scotty quite so down. I mean, he came in today, and Betty was she was in so much pain, and Scotty knew it. You know, she's getting worse. He's just really, really worried.
Basically, she was just chasing a ball, and she squeaked, and then I turned around and she was just dragging her legs towards me. She, since can't control her bowels, she can't control her bladder, and she's just getting increasingly painful.
Yeah, she's uncomfortable, isn't she? Give it a sec, Scott. I'm just going to get a little sling. I just need to see if she's got any much voluntary movement there. Yeah. I'll be right back.
Okay. Come on, honey. Come on. Come on. I know. I totally feel that I'm in the right place. Michael's known Betty as long as I've had her. So, you know, he has known how much I'm invested in this dog and how much I love her, and he will very quickly want to do the very best that he can as well.
She's got a little bit of voluntary movement in her left.
This looks awful.
Not much in the right, though. Okay. Right.
I just feel very privileged that they've just opened their doors and they've said, come on in, we'll do what we can as soon as we can, and I'm very lucky for that.
The most likely thing by a mile, given how she's painful, is that she's burst a disc in her back, and some of the content of the disc is now squashing the spinal cord. Okay. And then everything kind of downstream just isn't working very well. So that's the most likely thing.
Okay.
What we need to do is we need to try and get a look at her spinal cord and see if it's compressed, and if it is compressed, exactly where is it compressed? Because if that's the case, we can potentially do an operation to decompress, and then hopefully, a bit like a kind of a water hose with the messages going up and down. You put your foot in the hose, the messages don't work. You take your foot off the hose and the messages hopefully start again. We just got to get a move on, see if she's got compression or not, and if she does, decompress surgically.
Okay. All right then, honey. We're in the right place. Yeah. Okay, Uncle Michael will sort you out.
It's going to be wriggly, Ashton.
Probably. Probably. You're gonna be a wriggly girl, are you?
At the cherry tree surgery, Scott is clinging on to the hope that Michael will be able to help Betty walk again.
So what we're going to do, we're going to get her asleep, take some X-rays, then we're going to inject some of this stuff. This is a contrast agent into the space around her spinal cord where the spinal fluid sits, and then we take more X-rays, and then what that should do, that's going to highlight the spinal cord.
The little terrier fell over in the park chasing a ball and immediately lost the use of her back legs.
She's in a lot of pain, it's getting worse, and so, you know, if we do nothing, there's going to come a point whereby she can't even feel her feet, and then the prognosis gets worse, so, you know, time's kind of of the essence. Best mate, dog's in a bad old state, gotta bring my A game to fix this dog. Try and get her nice and straight. Okay, right, everybody out. When we stick the needle in, if we're in the right place, we'll see a little twitch, and then we might see some spinal fluids coming up through the needle, and then we're going to inject the contrast.
I thought I was gonna lose her. I was stripped of all control, and I had to put my faith in someone else. It really did clarify just how much she means to me.
So there it is, mate. If you look at the fluid underneath, just here, okay, this is all good, but you just kind of lose it around about here. So this is our one here.
Okay, but looking at that, you think that this definitely needs surgery, right?
Yeah, yeah, yeah.
I knew it was bad, but it's really bad.
Operating near the spinal cord has massive inherent risks. You know, the spinal cord, if the cells have died, they don't regenerate. So worst case scenario is she never walks again. Right, happy?
Yeah.
Have a 15 scalpel blade, please. 15 scalpel. Right, so there's a rib in there somewhere.
With all of Scott's family and friends waiting and hoping, surgery begins on Betty's compressed spinal cord.
You know, one slip, if you bang that spinal cord, it's game over.
Scott has decided to be present in the operating theatre, but it's not going to be easy.
Zoe really wants me to be in there just to kind of, you know, hold Betty's hand, as it were. So that's what I'm going to do.
This you can see here, this is actually the last rib, this thing here. Mm-hmm. And the disc that's popped is just under there somewhere. So we need to get into the spinal cord there.
The surgery that Michael's about to do is basically called a hemilaminectomy. It's removing part of the spinal column, the bony parts, to relieve pressure within.
And I think given that she's got worse and she's now paraplegic, we've got to do all we can, really.
It's a worrying moment because, yes, we're going to relieve any compression that might be present on the spine, which of course is great. But at that moment, we're going to know how badly injured Betty really is. And, you know, Michael's going to see a healthy spinal cord or one that's absolutely hammered. I think by the look on his face, I'll be able to tell. I can't believe how deep the exposure is.
It's quite a long way in, isn't it? Okay, so a normal healthy spinal cord looks a bit like cooked squid. It's kind of a white rubbery thing. And as soon as we got in there, it didn't look like that. It was quite red and quite bruised, which is a bit of a worry because that would imply that it's maybe been bashed, and that's bad news for the spinal cord.
How are you going, Michael?
Yeah, good.
Seeing Michael use the drill that close to my dog's spinal cord, I'm freaking out. It's not something I'm finding interesting or intriguing, all the things that I normally would feel when I'm watching a fellow veterinary professional perform their job. This time around, I'm just an owner and I'm not enjoying it at all.
This is the spinal cord, this bit here. I'm not going to touch it, but that's the spinal cord there. And in a minute, we're going to have a little poke under the spinal cord. But this big blob right here is disc material, that there.
And that all shouldn't be there.
That shouldn't be there, yeah. All of that, oh my God, that's a lot.
Oh my God.
All of that.
Look at all that.
Wow, look at that.
Jesus, there's so much of it. Removing this amount
This is good
of
news,
stuff
this is good news.
is good, right?
In many ways, yeah, because
that lot amount of stuff, that removed,
Yeah.
reduces huge amounts of pressure on
Yes.
my dog's spine.
yes.
I don't know if I should feel relief yet. Should I feel relief yet?
The slight concern, though,
Yeah.
is the spinal cord's quite bashed and bruised. The cord looks bruised. There's some disc material just kind of sitting there, so we removed that, and then we just kind of got underneath the cord, and we got probably the same again, and again, and again. There's the cord, there's one root, there's the cord, there's the next nerve root, and there's nothing under there now. I've been right there underneath, I can't get
And
any
that
more out.
bruising that you saw initially, do you think that's
It's-
more?
I think a lot of it was disc material sitting on, so the bit we were looking at was this bit right here.
Yeah.
But underneath there, it's bruised, but it's not quite as bad as I thought it was, so.
Okay.
I wasn't expecting that. This is a prize winner. It's going very, very well. Right, leave the suction on for a second. Is that all right, Michelle? Do you see that?
Yeah, amazing.
So what we're going to do now is going to...
Very, very good result, and I know he wouldn't say that to me unless he really meant it. So, yeah. So I'm really, really happy. Yeah. Yeah. Yeah, there's real hope with that now. Yeah, I might actually get my dog back, which is pretty cool. Yeah. Yeah.
Brave girl, brave girl. Betty's brave girl.
Betty was in a pretty bad way today. She's a grade 4 out of 5. She's what we call a paraplegic. We've decompressed quickly and we've decompressed a lot. So, you know, her prognosis is actually quite good. You know, she's got kind of an 85% chance of recovery. I don't want to jinx things, but I think she's going to do great.
Here we go. Ooh, she's so good. Such a brave girl.
While Michael is cautiously optimistic, he has warned Scott not to expect any sign of improvement for at least a week. A full recovery could take months, but it may never happen.
I will will her to walk again. I couldn't think of that not being the case. So I'm just gonna keep hoping that that's gonna happen, and that everything that everyone's done today is gonna make that difference.
Daddy loves you so much. Good. Hey, yeah, just gotta get better. Right? Get better.
Okay, baby. It's physio time. Yes, it is.
It's been 3 days since Betty's spinal surgery. Zoe asked Scott if she could look after the little terrier at home and give her round-the-clock care.
Bit of a massage, don't we, bits?
Betty's surgeon, Michael Hamilton, has warned them it could take up to a week for the patient to show any signs of movement in her paralysed limbs.
All that blood flowing through the muscle. Keep it all nice and stimulated.
There are no guarantees of a full recovery.
I think she's maybe a little brighter in herself, which is good. She's definitely pleased to see people when they come in. She's just frustrated she can't do her usual meet and greet at the door that Betty does like to do, with a lot of licking as well. But yeah, I think maybe a little brighter in herself. I think so, yeah. Stretch, honey bunch. Good girl, that's it. I know. Lay down, lay down. There definitely is something there. There's some sort of deep pain sensitivity there for sure. We're not getting any any reaction at the moment from the knuckle test. We're hoping that she'll correct her own paw on that, which she's not doing at the moment, but we just keep testing. She does her physio sort of 2 to 3 times a day. We're just going to keep testing it.
Come on, Betty. You can do it, baby. Spring back. Not today, but that's okay. That's okay. Not this morning. Maybe later, hey?
You are constantly on edge because you want to see an improvement, but you're scared you're going to see something to the contrary. It's really hard. It's really hard. It's what being a pet owner is.
And here we go. Good girl. Feet down.
But it doesn't make it any easier to see, doesn't make it any easier to do, and to watch Betty get so upset sometimes when she forgets that she can't move and she goes to step forward and she goes to come and see you. You see, she just gets genuinely sad in that moment, and she's such a good dog, you know? You don't want to see her like that.
Good girl, you're all done. Same again, 2 hours time, yeah? Yeah, same place, same time, Bubba. Come on.
Where's the squirrels? You gotta get up so you can go and play with them. Not that they'd call it playing with, would they? No. No, they wouldn't.
With his work over for the day, Scott can now focus on Betty again.
Where's the squirrel? Where's the squirrel? Where? Where is it?
As a special treat, he's carried her to the local park, and she's lapping up the one-on-one time.
Been a lot of clinical environments, a lot of injections and lots of tablets and lots of treatment going on and lots of sadness. And so to sit in the sun and to see her responding to the birds and the other dogs and the squirrels was just really nice. You know, this is her behaving like a dog.
Oh, what are those doggies doing? Are they running? You'll be able to do that soon. You will. You will.
But right now, there's really not much to write home about. You know, she can't move, she can't go to the toilet by herself, and even though Michael said, wait 7 days, it's just so tough. It's excruciating.
Just try and use your legs, baby.
Hope doesn't even go anywhere near to explain how much I'm willing her to get better, because I'm not even contemplating the alternative because I just don't want to. So she is going to get better.
Start using your legs and you can enjoy it all, can't you? Start walking again. That's what you need to do. Good girl. Here we go.
It's been 6 days since Betty's spinal surgery, and at last, there's positive signs.
Oh my word, look at you.
I know, she's even wagging her tail.
Oh,
look at that.
darling.
Wagging her tail.
The first sign of hope, the glimmer, was that Betty wagged her tail at my mother-in-law. Now, usually when mother-in-laws come into the house, you're not that impressed. But apparently my dog was.
And look, but she's actually
Betty.
doing her best to stand on her own now. See? Aren't she, sweetie? She's still very weak on the left, but she is so much stronger on the right. And she actually stood up yesterday, which is very exciting, wasn't it?
Who's a clever girl?
Didn't you?
Who's a clever girl? It's literally amazing.
Nice to see her a bit happier and a bit of spirit back, isn't it?
And back to licking.
Yeah.
Back to licking every inch of everybody.
Disgusting.
Wouldn't have you any other way. You know, everybody needs a win. We can't save every animal. We can't diagnose every problem in a heartbeat, you know? And to have Betty come in today, standing, wagging her tail, happy, smiling, and all of that is the biggest win that you could ever ask for, because alongside her was Scott, happy and smiling, and they come as a bit of a package, those two, I think, and it's just made everybody absolutely lift their spirits, and yeah, it's a good little tonic for everyone to have.
Hey, Jess.
Hey, Scott. Oh,
Look. Who's that? That's your little friend.
she looks amazing.
Yeah.
Oh, my goodness.
She's coming along really, really nicely. She's just starting to stand, and now it's all about trying to teach her to walk.
I've actually got a little something for Betty to help her with her walking.
Oh, wow, that is amazing. Wow, so a little sort of stretchy sling support thing.
That's right.
Made of dressing material. I can even see you've braided dressing material. Can't even braid my kid's hair. That's unbelievable.
All right. She's a special little girl, so had to be done.
The whole team have been just so supportive during this really fairly tragic journey. And I know that both they really want to see Betty and Betty really wants to see them. Good girl.
Oh, Betty.
Ooh.
Look at that.
Wow.
Look at
Yes,
those
that works so
legs.
well. Every single day I'm seeing big jumps. I'm going to continue to push her as much as I can, offer up everything I can to really just get the dog back that I love. Come on, clever girl. Look at that. What a good girl. That's it. And I know she can do it. She's a brave, plucky little dog. That's it. There is seemingly a light at the end of the tunnel. Clever girl. You are so clever. Well done, honey. Show us what you got. Good girl. That's it.
And 1 week later.
That's it. Nice and slowly. Clever girl. What a clever girl. Good girl. Good walking, honey. Well done. Well done. Well done. Good girl. It was an incredibly special moment when I knew Betty was back.
Come, Betty. Come on.
Summer, my eldest daughter, called her and she actually stood up and walked to her. And we're just so, so grateful for that.
She's all better. She's got all her legs except for that back left one. It's really getting better.
The decision-making process that I went through with Betty, I think, crystallises just how much you need to listen to owners because they do know their animals. And I knew my dog. Good girl. I've been a vet for a long time and I've really never felt what it's like to have the shoe on the other foot. And if I didn't take my job seriously before, I certainly do appreciate it now.
That is to take her temperature.
Quinn totally wants to be a vet, so she'll copy anything that Daddy does.
She has 1,000,000.
So poor old Betty, sick or otherwise, she's gonna get the treatment. And Summer is just such a loving kid. They all are. But that's definitely Summer's role is the cuddles, and Quinn's role is the medicine. So it works quite well. Betty seems happy.
I absolutely love Betty. She gives me so many kisses because I do so much nice things. Thank you, Betty, very much.
I think it was really difficult to keep the faith as the minutes and the hours and the days ticked by and Betty wasn't showing any signs of improvement. And it's balancing your emotions at the same time as the kids constantly asking, when is Betty going to walk? Is she walking yet, Dad? Those heartbreaking things that you are protecting them from what might be an inevitable outcome of a paralysed dog. It couldn't have been more difficult.
You can make her better.
I think the journey I've been through with Betty is catharsis. It's literally like someone has written down my life and the job that I do and then showed it to me. And through that window, I can see just how important my profession is to people's lives. And I don't think there's ever a point in my life where I can say that I'm more proud to be a vet.
I know, he's a good boy. Good boy.
In Richmond, one of Scott's long-term patients is enjoying a few quiet cuddles with devoted owner Sarah.
Badger is our 12-and-a-half-year-old Irish Terrier that we've had since he was about 6 months old, and he's been the best dog we could have ever wished for. There isn't a day that goes by that I don't find him dressed as a witch or a fairy or he's just been an amazing part of the family.
But Badger's been battling a massive low-level malignant tumour.
Sore, isn't it?
And despite 2 major surgeries, it keeps growing back.
So we're sort of worried that if it isn't addressed, it's going to split the skin because it really is stretched. And it's like, it goes all the way underneath, sort of almost like a sort of tennis ball size, and then this bit underneath. So it's pretty grotesque. We sort of promised ourselves that we wouldn't operate again. Scott's done both operations previously, and we kind of drew a line under it and went, right, we're done. We're not going to do that again. But it's sort of got bigger and bigger, and, he's relatively happy in every other way, and we're now kind of like back in the situation of, what do we do? Badge, do you want to go for walkies? Yeah? Oh, come on, fella. Oh. Come on, boys. And let's go.
Good boy. We've got to go and see Scotty. Okay? Come on. Good boy. Got to get you up the hill.
As Sarah heads in to see Scott, she's bracing herself for the possibility that Badger will need a third surgery.
Come on, then. Let's do it.
That's a good boy.
Hi, Kirsty. Hi, Sarah. How are you?
All right, here we are again.
Oh, hello, Badger. How's he doing? All right?
Yeah, he's doing okay, but, you know, the lump's really big now, so I think...
See, can't you?
Yeah, I think it's kind of decision time, so I'll have a chat with Scott.
Oh, do you want to take a seat? He'll be right with you. Just let him know you're here.
Thanks, love.
All right.
Hi, Sarah.
Scott, how are
Hello, Badge. How are you, mate? You all right? You're a very happy boy today. Goodness me, I can see why you've come in.
Yeah, it's not slowing down.
It is not. It's quite monstrous at the moment, isn't it, mate?
All right, all right,
Yes.
all right.
Oh, is that a bit tender?
Come
oh,
here.
bless you. Come on, let's keep the happy boy, hey? The waggy tail's what we want. Come on then, Badge, you're gonna come this way? Come to the consult room? Come on.
Boy.
Good boy. Well done. Good lad. Didn't you come? There we go. Well done. So it's been a few weeks since we've seen each other, and unfortunately that has grown, hasn't it?
Yeah, it's definitely, it's not slowing down.
No. And how's he being affected by it, do you think?
Well, I think slowing down, he's, you know, he's not as inclined to sort of go for a walk as much as he was. You can tell it's just really cumbersome and it's awkward. He's finding it hard to find a comfortable spot to sit down.
This is a massive tumour that's really pulling his weight off to one side, which will be affecting his balance, will be causing an increase in arthritic development in the back legs. There's a lot of negatives to this thing, besides the fact that it's stretching the muscles that it surrounds and causing him discomfort.
He still wags his tail whenever anyone goes near him. He still wants to go for a walk, albeit a short one. So I feel like we're doing him an injustice if we just leave it.
Okay, well,
But
let's...
it's a hard decision.
It's a very hard decision, really. It is, and we flip-flop about it constantly whenever we see each other, don't we? This is not the first time that we've considered removing Badger's tumour. It's a slow-growing sarcoma, which is a malignant type of tumour, but it's one that doesn't tend to spread. It just continues to regrow in the same site. Now, unfortunately, the size of this tumour and where it is means that we can't ever remove it completely. So unfortunately, it keeps growing back, and this is now the third time that's happened. So I think what we might have to do is just pop a muzzle on him. All right, champ, it's Hannibal Lecter time.
Yeah, come here, Badge.
Come on. He's a gentleman until he's challenged, and then he turns into a bit of a beast.
Yes.
Don't you, mate? Hey? No, you just know your own mind, don't you? Yes. Okay, you ready, Sarah? I'm gonna pop him up.
Want me to lift or you?
No, we'll go. Oh, good boy, good boy, good boy. Wow. This tumour is absolutely huge. Sort of see it coming out from his chest. It's almost like he's got an udder, isn't it? Like it's just...
It's like a cricket ball, isn't
Yeah.
it? And it's sort of that hard as well.
Yeah, it's huge. There's positives and negatives.
Yeah.
But I think the thing is that he is a lovely, otherwise healthy family dog.
Yeah.
Except for this. So if I can rid him of this one last time and give him the, you know, old age, genteel life enrichment that he deserves, well, I think he deserves it.
Yeah.
Yeah.
The worst thing would be for him to not come through surgery. I think, you know, we haven't got a choice now. He's just, you know, he's in too much discomfort. I think we've got to do it. So, yeah, I am worried. Cheerio, Boise. Be good. Come through it. Okay. All right, thank
Okay,
you.
love to you and the family.
See you later.
All right,
Bye.
see ya. Bye.
Bye.
Say bye, Mummy. Say bye. Oh, I know. You've got to be such a brave boy. Yes, you do. Hey, you're... Hey, yes, so... Badger's back, Nath?
Yes.
He says with a worried look in his eye.
He's a really sweet dog, but just not the best patient.
Agreed, hence the muzzle.
At Scott's Richmond clinic, Badger is about to undergo major surgery to remove the massive tumour growing on his chest.
Reagan, I don't know if you've met Badger.
No, I have not. That is crazy.
Yeah, it's not his most attractive feature. He's a champ. No. Unfortunately, I'd love to say that this is the first time we've removed it, but it's actually our third.
Oh, really?
Yeah, it's a slow-growing sarcoma. It doesn't actually spread anywhere else in his body, but just continues to want to live on this side of his chest. And you can just think how taut. It's so tight, you can feel it.
Yeah.
And so it's stretching all those muscles, and that's what's so uncomfortable. That's why you're panting all the time, aren't you, mate? Because you're just a little bit low-level uncomfortable all the time. Oh. So this time, third time lucky. Wow, look how vascular it is as well.
With Badger's fur shaved off, the huge scar from his 2 previous surgeries is clearly visible.
Right, here we go.
It's the line Scott is using to go in for a 3rd time.
It has some semblance of being fatty, but it's granular. It just doesn't have any structure. I mean, once you get your finger, I mean, it's just soft. Going in to remove this tumour, it is just hideous. It's just everything that you would think would personify cancer. It has no structure to it. It pulls out like kind of wet porridge. There's a lot of blood supply to it as well. It's just huge and it's just horrible.
The nasty tumour is especially confronting for Scott's new nurse, Reagan.
No, I didn't expect it to be... Well, I don't really know what I was expecting, but not...
Not this.
Not this, no.
No,
No, not quite.
Yeah.
20 minutes into the surgery, Scott is becoming increasingly concerned.
Badger's actually losing quite a bit of blood removing this because it's just so vascular. It's within all the muscle layers of the chest, and we can't control it because the blood vessels there's no rhyme or reason to them. They're not growing in the normal way. So I'm just doing my best to remove as much of the tissue as quick as possible. But it's a little bit nerve-wracking at the moment.
After 25 minutes, Scott has removed as much of the tumour as he can safely manage.
I'm gonna pull out, close it up. I've got as much out as I can.
But suddenly...
Have you got a heartbeat?
Badger's condition starts to deteriorate.
Oh yeah, I have got one. It's not very strong.
Yeah, we just need to keep a very close eye on that. Okay, just have a listen that he's definitely got a pulse still. Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into consult, just ask James.
Badger's tumour removal surgery has now turned into an emergency. With Badger's condition rapidly deteriorating...
Can you just put your arm up there and just have a feel for a pulse?
Scott has called in vet James to assist.
You can't feel the pulse? All hands on deck. I still am in a situation where I'm sterile, trying to complete the surgery because we can't stop the anaesthetic until I've closed this massive wound. So it does mean that I am hog-tied. I can't use my hands, so I need my colleague James to come in and help with the CPR.
He's taking a breath.
That's a breath in.
Yeah.
Right, the breathing is the really important thing, so just keep on breathing for him. Don't stop.
I put him on 2 and just see how it goes.
Yep. Have you got a heartbeat? Can you hear?
I can. Oh yeah, I have got one. It's not very strong.
Is that him then? Let's throw some adrenaline at him. Same dose.
Precious minutes are ticking by. But now, Badger is not responding.
Can you feel anything?
I can't hear anything.
No adrenaline now?
Yeah. Anything?
Badger has now been unresponsive for over 6 minutes. And Scott is forced to make an agonising decision.
Okay, I'm just gonna call it, guys. Okay, well, good work, everyone. Okay. It's one of those things.
Yeah, you had to do the surgery, Scott.
Yeah.
You can't really...
Can't leave it the way it was.
No.
think the looks on everyone's faces, I think, says it all. Everyone's completely gutted, and especially Scott.
Okay.
Scott now has to make a heartbreaking phone call.
Oh, hi, Sarah. Hi, Scott here. Hiya. Yeah, I haven't got good news for you, I'm afraid, Sarah. Yeah, he passed away on the table, I'm afraid.
Oh, my God. Oh, what happened? Tell me.
I got probably 2/3 of the tumour out and was just sort of cleaning up the edges before closing. He stopped breathing, and this time I couldn't get him back.
Oh, Lord. I just was so sure he was going to come through the surgery.
So did I. That's why I'm like, I'm so sorry, Sarah. Yeah, she's devastated, as you would imagine. Straight away, as a parent, she's thinking about the kids and thinking about the fact that she decided not to tell them before the surgery, thinking that they would worry. And so now, obviously, they're going to be so heartbroken that they didn't get a chance to say goodbye, which is just, you know, thinking about my kids and thinking about that happening to my dog, it would be very hard. So it's a bad, bad day. Yeah. Sorry, mate.
All right.
Nearby, Claire's getting ready to bring in her German short-haired pointer after a lump was discovered on Lola's neck.
I didn't find it myself. It wasn't visible to look at. A friend of mine was petting the dogs when she was looking after them. And the next time I saw her, she said, "Oh, you know, Lola's got a lump on her neck." I was like, what? No, I did not know that Lola had a lump on her neck. Of course, whenever anybody says it's a lump, the first thing you think is, oh my God, it could be cancer, it could be serious.
Oh!
Right now, Lola's showing no symptoms, and her little mate Betty is showing no sympathy.
I know.
But Claire is not coping nearly as well. A year ago, her life changed forever when she made a sea change to Cornwall with her 3 dogs.
It was me, Lola, a miniature Schnauzer called Scruffy, and a miniature Dachshund called Sprout.
The little family loved their walks on the beach, until one day a freak wave crashed in and dragged them all out to sea.
The undertow was just unbelievable, and the beach was shingle. It was like being on ball bearings, and I was just sucked out. I thought, this is it. This is where I die. I don't get to say goodbye to anybody. The next wave, I hit the beach and I jammed my arms and my feet into the shingle as hard as I could. And I scrambled up onto the bottom of the seawall. And I looked around and Lola was there. So she either not got sucked in or got herself out. She's muscly and she's strong, so she had the strength. And I turned around and I could see Sprout's body floating upside down. And I saw the end of Scruffy's tail. And then the wave came in. And I just started screaming. And that was just so fast. 1 minute we're sitting on the beach, enjoying the sunshine, the next minute they're just gone. She wasn't this grey before the accident. She got all grey.
Claire couldn't face living near the beach anymore and finally sold up and moved back to Richmond. Both she and Lola were scarred.
Lola was terrified of life. She was just completely frozen. Getting her to eat after the accident was an absolute nightmare. She was just, no, not interested. She's so stubborn.
Finally, Claire decided there was only one answer. This little terrier puppy turned out to be the therapy they both needed.
When I was watching them this morning, climbing all over each other, I was thinking, oh, we've come such a long way. And she's so much happier. She's kind of almost regained some of her puppyhood. So, yeah, it's a completely different world. Better go and get it checked out, love.
But now it's time for Lola's appointment with Scott.
You try and think, oh, you know, it'll be fine. Surely I won't be so unlucky. But, oh, God, it would be heartbreaking. The thought of losing her on top of everything else. You all right? I'll go and see Scott.
Hello, lovely ladies. How are you?
Nice to see you.
And you. Hello, Lola. Hello, beautiful.
Scott's now ready for his consult with Claire and Lola.
Come on in. So, what is our beautiful girl in for today?
She has a lump on her neck here on your side.
Okay.
A friend of mine noticed it.
Right. Oh, yeah. That is a little bit of a concern.
The worst case scenario for this is the big C, it's cancer. That would be an absolute nightmare. If I felt it in my dog, yes, we can take samples and we can do all sorts of things. But I think after everything that you guys have been through, I don't really want to risk it.
No.
And I actually kind of feel that if it was my dog, I would just want it out and dealt with.
Whatever she needs, then that's what we'll do. Hey, baby, we can't have you sick. No, we can't have you sick.
It's just such a tragedy that just as you see them getting to the top of the mountain, Lola and Claire seeming happier and settled back here in Richmond, that they're hit with this. And I don't want to be the one bringing them any more heartache. They simply don't deserve it. So Claire, I always think in these instances that take the Band-Aid off quickly. All right, so I think if you head off,
Okay.
I will look after your girl, we'll get it done as soon as possible,
Yes.
and then we'll move forward together.
Okay.
Okay, all right.
Thank you.
And you know I'm gonna take care of her.
Yes, I know you will. Go on. Scott's almost as good as me.
Almost.
Bye.
See you later. Say bye, Mummy.
It's hard saying goodbye to her because I know she's going to get upset. She's likely going to be anxious and confused and scared. It's a bit that really upsets me.
Let's give you some nice, happy drugs, get you chilled out and get that horrible lump taken out. Yeah. Good girl.
Time for sleeps.
At the Richmond practice, Scott and head vet nurse Emma are about to start the surgery to remove Lola's suspicious-looking lump.
Mummy would be proud of you, wouldn't she? Yeah. German short-haired pointers are known to suffer with certain types of soft tissue cancers. And in my nearly 20-year experience, I've seen quite a number. Em, have a look at this. This is the lump I don't like the look or feel of.
Has it been growing for quite a while?
She's only just picked it up. And the problem is, if she's only just picked it up, that means it's growing quickly.
Yeah.
And growing quickly, we know, is a good indication of malignancy of cancer. That's why I feel so strongly that we need to get in, get rid of whatever this is, and hopefully give Claire the result she's looking for, which is a clear one. So I'm just gonna cut through the skin and have a good look at it and see if I can remove the whole thing. I'm liking the look of this more and more.
Oh, there it is.
Thank God, this looks like it might be something benign.
So the minute that Scott made the first incision, I think both of our eyes lit up when we saw this big lump of fat.
When a mass looks fatty, it could be something called a lipoma, which is a benign lump, not cancerous, which would be totally awesome. And that's a veterinary technical term.
Totally awesome. Yes.
For a relieved vet.
Yes.
But Scott's relief is short-lived.
Right next to the jugular.
Nice and easy with the scissors, Doc.
While the mass does appear to be benign, it's dangerously wrapped around the jugular vein, which is the very large blood vessel carrying blood from the head back to the heart.
There's the jugular vein right there.
If this vein is cut, the patient can die within minutes.
I was pushed to the limit because we're literally millimetres away from cutting a major blood vessel and causing a huge amount of blood loss.
It's holding on for dear life, this thing. Get out.
Like all fat. It just doesn't want to go anywhere. It's the hardest thing to get rid of.
Hmm.
Okay.
Very close to the jugular. It's the whole lump. Here we go.
At last, Scott is satisfied he's removed the entire mass, and the jugular vein is still intact.
If I'd cut that bad boy, I would have definitely made a mess of your surgery room.
Blood splatter's not so easy to get off some white walls. Very cranky nurse on your hands.
You'd be mad, Claire would be mad. Yeah, I'm really glad that I didn't.
The relief that I felt when I could see that this wasn't a mass that was going to be life-threatening was just overwhelming.
Fantastic. Never have I thought looking at fat would be
So satisfying.
so satisfying.
This is definitely a day where fat is good.
There was an absolute wave of positivity. I couldn't get the smile off my face. I was absolutely elated.
Oh, you're good, aren't you? What a brave girl. Yeah, what a brave girl.
Oh,
thank you, sweetie.
Kisses for Dr. Scott. I think Lola was definitely saying thank you. She looked into his eyes and gave him a little kiss on the nose. I actually had a tear in my eye. It was beautiful.
That's nice. Yeah.
I cannot wait for Lola to wake up and just to send her home with Mum, get a kiss and a chew probably from Betty, and to give Claire the good news. I'm sure she's going to be ecstatic.
Let's let you have a snooze and we'll call Mummy. Yeah.
There we go. Good boy. There, look, Vanilla here.
Scott and many other general practice vets regularly refer patients to the college to handle specialised cases. Today, little Bob is scheduled for open heart surgery with Professor Dan Brockman.
Hello there, Mrs. Cunningham. Nice to meet you.
All right, nice to see you.
How are you doing, Bob?
I think it was really the quality of Bob's life that made me decide to put Bob through this operation. He's getting increasingly laboured with his breathing.
Just huffing a little bit, isn't
Yeah,
he?
he is a
Let's
little
get
bit,
him into
yeah.
the consulting room.
OK, right, great, thank you. It's not really much of a life for a dog because we can't take him down the park, he can't play with other dogs. It was time to get that sorted. Yeah, you don't mind the vet.
For Bob's cardiac surgeon, it's going to be another challenging day.
The objective of this operation is to try and turn his heart back into a normal heart so that he has not only a normal quality of life, but hopefully a normal life expectancy as well.
Exactly, yeah. Nice long life, Bob, yeah?
The condition that Bob has is called tetralogy of Fallot. He has a hole between the left side and the right side of his hearts. And because he has a hole between the two, he's constantly getting a mixture of oxygenated and deoxygenated blood pumping around his circulation. So his body thinks that he hasn't got enough oxygen, and it's true, he doesn't. But I'm afraid none of it comes with a guarantee. If we don't do anything for him, unfortunately, his blood will get like treacle and it won't be able to go through his blood vessels. And so it's fair to say that this is a very high risk. Doing nothing is very high risk too. He's got a condition that is going to kill him.
I have brought some stuff with me for him, if that's all right. I'll just go through what we've got. We've got your duck. It's your favourite... Oh, dear. No. Your favourite toilet?
To make things even harder, Bob is Georgina's first puppy.
Here we go. Come on, then. And you're going to keep your blankie with you, yeah?
They may have only been together for 3 months, but the terrier is already a big part of her life.
Excuse me. Come on, lad. There we go. We close that up. Your Bob-sized bag, eh? Leaving Bob here today is really stressful. I haven't been without Bob since we got him because we've had to take care of him so closely. We've become very close. And so it's going to be really strange letting him go and letting somebody else take care of him. Good luck, Bob. You're going to be fine, aren't you, eh? You get your lucky collar and you're going to be a champion, Bob, OK? You take good care. We'll be waiting for that call, I think, which is going to be obviously the most worrying part of it and the scariest part. So I'm going to try not to think about it. Thank you very much. Thank you. Take good care of him, won't you? Thank you.
Will do.
Bye, Bob. Good boy. Bye-bye, Bob.
Okay, everyone, this is Bob. He's a Lakeland Terrier that's 5 months old, and during this operation we've got to open his heart, close the hole in his heart, and open up the blood flow so that his lungs can get more blood.
At the RVC, cardiac surgeon Dan Brockman is about to start the open heart surgery, which he hopes will save the life of 5-month-old puppy Bob.
We're ready to make a start? Okay, cutting. Second clamp coming off. And let's go on bypass and cool to 28, please.
With the puppy's blood diverted through a bypass machine, the medical team can now start plugging the hole between Bob's left and right ventricles with a Gore-Tex disc.
Are you okay on that side?
A second patch will then be sewn over the right ventricle.
Scissors again, please.
In order to improve the blood flow to Bob's lungs and get his blood pressure to a safe level.
I've put the heart back in the chest. Hopefully the heart will start to look a better colour now. The open heart part of the operation has been completed now. We're in a very tricky phase, and so I'm a bit nervous in that we've done what we set out to do, but he's by no means out of the woods yet, so we can't afford to lose focus yet. That's a bit worrying because his pressure's falling. Yeah.
The medical team is desperately trying to wean Bob off the bypass machine.
And you've got blood and plasma still going in?
Yeah, plasma, yes.
But the puppy's blood pressure is dropping dangerously.
So I think we tried to make his blood pressure better. We're very concerned now that it might be that what we've done hasn't actually helped him. A mean of 50 now.
Bob's condition is rapidly deteriorating.
Has it stopped again?
His heart has gone into fatal arrhythmia.
Clear.
The team are now trying to shock the puppy's heart back into life.
No. Try 50. No. Give him one more shot at 50.
Clear.
Nothing. That's it, fellas. It's devastating. I mean, the whole team puts so much effort into this, and we all do it because we want to give dogs like Bob a chance. And I suppose the only comfort is that without us, he would have had no chance at all. Having done this for nearly 30 years, I can say you never get used to losing patients. It's a bitter blow for all of us. Thank you very much, everyone.
For Bob's owner, Georgina, it's devastating news.
Hey, yeah, I'll show you your tongue. Look.
But she'll never forget her precious time with her first puppy.
Good boy. I think having Bob did change our lives. Bob was just so cute and tiny. I think we probably fell in love with him straight away. Giving Bob the surgery was definitely the right decision. I don't think we'd have been able to live with it if we hadn't given him the best chance that we could have done. Come on, Rocky, this way. Let's try our first walk. Good boy.
On the south coast in Worthing, Georgina now has a new companion to help cope with her grief.
Good boy, Rocky. Come on.
It's been 3 weeks since she lost her first puppy, Bob, after complications during his open heart surgery.
Good boy. We've got Rocky now in our lives, so it's mixed emotions because we're still really sad about Bob. We have his teddy at home, we have his collar and things like that. Yeah, look, poor little Bob. He couldn't go for a walk, could he? So you and me, we're going to have a good go today. We're going to go and have a look at the park, see if we can see some birds, find some squirrels. And what a lovely day for it, eh? Isn't it beautiful, eh? We really miss Bob. I really miss Bob. But Rocky, we're finding already, is really going to help us sort of come to terms with losing Bob and really give us the little family unit and the future that we wanted. Here we go. Here we go. Hold on. Yeah, he's a good lad.
I'm just on my way to Mudshoot Farm, which is a really inspiring place where Londoners can go and visit farm animals, but in the city. Now, Farmer Tom has given me a call because there's a rather mischievous new recruit, so he's asked me to come up and check him out to make sure that he's A-OK.
Hello, sir. How you doing? How's it going, Tom? Good to see you, mate.
Tom has hundreds of animals in his care, but it's a newly arrived orphan rabbit that's the reason for Tom's call to Scott.
We thought when the rabbit was found, I mean, he was dumped in a box just on one of the entrances to the farm, and I thought when it became apparent that he would need a little bit of surgery, that Scott would be the man to phone. We'll go and see him, shall we?
Yeah, sure. Let's go.
Right, so here he is.
Let's have a look at him. So what's the name of my patient today, Tom?
He's been christened Cookie.
Cookie, OK.
Yep.
All right.
See if we can get him.
Yeah. This wrangling rabbits thing can actually prove quite difficult.
Yeah, he's going to give us the runaround, that's for sure.
Where are you, mate?
In classic rabbit style, they are very difficult to catch. I don't think they are that impressed by a vet visit, and they're trying their best to escape my clutches.
There he is.
Come on.
Oh, yeah, got him. OK, come here, mate. You're quick, but you're not quick enough. How's it going?
Hello there. You OK?
He seems bright and healthy, and as you see, he's moving.
He's
all
moving
right.
very well. Definitely quite strong and healthy. Nice teeth as well. Boy. A little feel of your tummy.
OK, well, I mean, generally, physically, he's a very fine specimen, so...
Have you noticed any concerning issues or physical traits you're bothered about?
There is one problem that sort of got a little bit bigger.
Right.
Really. I think he may need to be castrated.
Right.
Yeah.
What have you been up to, sir? So once I finally get hold of Cookie and I have a look at him, clearly he's a very happy rabbit, but Tom informs me that he's been quite the naughty boy.
They're just down in here.
Oh, my goodness, they are so cute, aren't they? Beautiful.
Yeah.
And I think it's fair to say that they are Cookie's kids because
they are.
3 of them look very clearly like him, don't they?
Yep.
And how many babies are we looking at here?
There's
lots.
actually 9 in there.
Wow.
What happened was a bit of an accident. Basically, as someone was going in to feed the girls, they had let the boy out first and he quickly saw his chance. I think he was in there for only 30 seconds, a couple of minutes, something like that. So it doesn't take much time. I think if you would have blinked, you would have missed it, but there you go.
Oh, dear.
We definitely don't need another 30 seconds, do we?
No, we don't need a repeat performance.
No.
So now Tom wants Scott to take Cookie back to the Richmond practice for castration surgery.
Well, let us know how you get on.
Well, come on then, let's go. Hey, Nath.
Oh, hi, Scott. What have you got for us today, then?
Well, I've got a very handsome Lothario, and it isn't me, it's him.
At the Richmond clinic, Scott has arrived back from Mudshoot Farm with Cookie for the rabbit's castration surgery.
He's managed to father some babies at Mudshoot Farm that they didn't quite expect were going to be running around, and now we just need to put paid to his stud behaviour.
Assisting Scott is vet nurse Nathan.
I think this is the one all the fathers warn their girls about, isn't it?
This rabbit?
Yeah.
Oh, definitely. He wouldn't get past the front door of my place. Seriously, that's it. OK, well, let's get to work. Sorry, buddy. Oh, ouchie. I know, ouchie, ouchie. Good boy.
Yeah, all okay.
Anaesthetics in rabbits can be quite fraught because they're quite nervous, stressful animals, and they're also quite delicate as well.
Is it moving the bag? It's just this colour's not great.
Just moments into the procedure, Scott is concerned about Cookie's breathing.
Can you just be quiet for a second?
Just a breath.
There you go, but that's moving, so...
Yeah, he's breathing.
Yeah, actually his colour's improving now. It just pushed it back a little bit further. Okay.
This is an early scare that I don't need. Cookie's breathing seems a little bit irregular.
If you want to take him through and then I'll get scrubbed up.
But now, hopefully, it's stabilised.
Okay. So just looking at his colour, it's gone a bit purple.
But seconds later, Cookie is in trouble again.
Running into the surgery room, I can see that Cookie is blue and he is simply not breathing.
His colour's awful. Extend his neck.
We set to work straight away, trying to stimulate him to start breathing again.
Can you see breath there? His heart's still going.
Yeah, heart's still going.
Breath?
Yeah, heart rate's come up.
Seeing that Cookie isn't breathing and that he's going blue, it's very, very nerve-wracking. These are very stressful, nervous animals, and they are prone to anaesthetic reactions, basically where the drugs that we use aren't well received by the patient's system, and that seems to be the case here with Cookie.
His heart's strong.
Yeah, you can see the blood pumping through. It's kind of like...
It's good.
His colour's better.
Yeah, but I think we should get the antecedent into him anyway. I just don't like this.
Nathan and I are battling really hard to try and get Cookie to breathe again, and the worry is starting to rise in me. So I decide that we're going to pull out of the anaesthetic altogether. So we give him the reversal agent, which should mop up all the drugs that we knocked him out with in the first place.
You just need to keep stimulating. Come on. Can't feel anything, No.
It's a real battle to keep Cookie alive. We are breathing for him. We are trying to stimulate him to start breathing on his own, at the same time listening very intently to his heart, which is beginning to slow.
Come on, mate.
Cookie has now been unresponsive for 6 minutes, despite Scott's use of numerous medications to try to stimulate the rabbit's system.
He's gone.
Despite our best efforts, Cookie is simply not responding, and sadly, his heart stops.
After battling to save the little rabbit, Scott and Nathan are devastated.
So our patient's passed away, which is heartbreaking. Yeah, we fought valiantly as much as and as hard as we could, but he just seemed to react very badly to the drugs, and you never know that until you give a drug. And then you fight to counter the side effects. And we're incredibly shocked and upset that this has happened on our watch. We're trained to deal with these situations, but unfortunately, this one we didn't win, and Nathan and I are heartbroken.
So how are the babies getting on?
They're doing really well. Growing like there's no tomorrow, so yeah, have a look and see what you reckon.
6 weeks later, Scott is back at Mudchute Farm. Tom wants him to check up on some of Cookie's offspring.
We've got 3 that we've decided to keep.
Oh, great.
So they're going to be staying on the farm, so those are the ones that we'll have a look at now.
Nice.
Right, here they are.
Oh, my goodness. They are gorgeous.
Yeah, we'll go in and have a closer look.
Oh, look at that. That one's literally a mirror image of its dad.
It certainly is.
Oh, my goodness, like a mini Cookie. Oh. And
go.
just as feisty.
That's it, exactly.
Oh, hello, beautiful. Oh my goodness, these rabbits are so cute. They are absolutely beautiful. And one of them is the absolute picture of Cookie. Oh, wow. What an amazing legacy.
I know,
Cookie.
don't they? They're lovely.
Do we know if they're boys or girls yet?
I haven't had a look yet because I think they're still a little bit too young, but maybe you can have a look and see.
Should I have a little look? So I'm pretty sure that this guy is following after his dad's footsteps. Hey, chip off the old block. All right, sweetheart. So that one's a female.
Yep.
And then last but not least, let's have a look at you. I think this one's also a girl.
Mm-hmm. The examination of the babies went really well, and we've found out we've got 1 boy and 2 girls. The 3 babies will stay here for the rest of their natural lives, so they'll be in a happy, functioning social group, providing happiness to many, many children and adults that come and visit the farm.
Have you thought of names yet?
Well, because obviously Dad was called Cookie, we were thinking about biscuits.
Biscuit-inspired names.
That's it, yes.
Okay. Well, one biscuit that I desperately miss from home is this chocolate extravaganza, which is a Tim Tam. So I wonder if maybe, do you want to be Tim Tam? They're really nice, really nice. And then what about you? What's your favourite biscuit?
Well, I like chocolate digestives.
Okay, so maybe we should go with the brown one on that one.
Yep.
All right, and then I think the English biscuit that I think is amazing is a hobnob. Everyone loves a hobnob, come on.
So we can call this little one here.
There we go. It's bittersweet visiting Mudsheet Farm today. On one hand, I'm heartbroken at not returning with Cookie, but happy to check on his lasting legacy, his babies. As a vet, we're trained to accept that sometimes complications happen, but that doesn't mean that it doesn't hurt. But life goes on, and it's great to see that this Randy Rabbit's offspring are happy and healthy and continuing to delight the urban kids who love this special place. Nice one, Tim Tam. Maybe we'll go and get a cup of tea and toast your health. Yeah. Hello?
Hey, Scott, it's Maz. Listen, we need you to get back to the clinic as soon as possible, OK? We've got an emergency that's come in. Charlie's been brought in. He's collapsed and barely conscious. Steph and Emma are doing everything they can to keep him stable until you get back, but I really need you here as soon as possible.
Okay, no worries. I'll be there as soon as I can.
OK, great. Thanks.
Okay, bye. Gee, that doesn't sound good.
Head vet nurse Emma and locum vet Steph are at the clinic trying to stabilise a critical patient, 6-year-old Wheaton Terrier Charlie.
So this morning we get a call about Charlie to say that he's off his back legs. So I was expecting to just find Charlie a little bit stiff and not able to get up. What I found was a completely different story.
Charlie's a fantastic dog. He's been coming to my practice for a number of years now, and we're all really fond of him. But he's been really unwell of late, and if he's gone into the practice for an emergency, you know it's going to be bad.
When Charlie arrived into the practice, when we finally got him back, he was barely breathing. He was semi-conscious, but he was also in a lot of pain. So Steph and I started Charlie's immediate care along with the other nurses. But as Charlie is one of Scott's long-standing patients, we know that we just need to get him back in the building as soon as possible.
Oh,
Hey, Maz. How is he?
Hanging in there, but barely.
Okay. Right, guys, what have we got?
Hi, Scott.
Oh, yeah.
Okay, so we've got Charlie here.
Just like Bam Bam, Charlie's family is also away on holiday. The grandparents called the practice to say the Wheaton Terrier had collapsed.
We went to the house to go and see what the situation was.
He seems quite painful even now.
Yeah,
We've
yes.
given him something for pain.
So we've given him some pain relief. We assessed the situation, got him over here because he was collapsed. He was really in a bad way.
Dead on the scene when we saw
Really?
him this morning.
Okay.
Charlie has a condition called immune-mediated thrombocytopenia. It's basically where his own body is attacking platelets, and those are the cells important for clotting blood. Right now, his platelet count is at an all-time low, he's bleeding everywhere, and he's in real trouble. We're unsure as to exactly what has caused the body to behave that way, but we have a feeling that he may have a condition called leishmania. Leishmania is a very nasty disease spread by sandflies, particularly in southern Europe. Charlie went on a holiday recently. He must have been bitten when he was away on holiday. He's come back, and this condition is manifested in lots and lots of different ways. His kidneys are affected, his skin's affected, his joints are affected. He is a very, very unwell dog right now. Well, I can see straight away that his gums are exceptionally pale.
And the particular hemorrhaging.
You can see he's got some hemorrhages. So we've done some initial blood work. The blood work shows that he is severely anemic, and he is actually going to need a blood transfusion.
Okay. His platelet count is, there aren't any.
Okay.
As you know, lowest it should be is about 35%. His is at 15.
Right, so it's no surprise he's bleeding from everywhere,
He's
including...
bleeding from everywhere, and
time is of the essence.
That's right.
Okay. So I
And,
think what the big thing is now is about the blood transfusion. So in this instance, of course, we would normally do blood typing to be able to determine if there'd be any reaction. We just don't have time here. So we need quite a bit of blood for Charlie. So as a result, we need quite a large dog to provide it. The only person I can think of that's got a dog of any half-decent size is Nathan.
Yes.
So let's give him a
Lovely
yell
Maisie.
and pull in Maisie and see if she can donate some blood for little Charlie here. So the main medical issue that Charlie is suffering with is anemia. So he has a low red blood cell count. He's very pale, he's struggling to breathe. So what we're trying to do is to supplement the red blood cells by giving him a blood transfusion.
Hello?
Hey, Nath, it's Maz. Charlie's been rushed in this morning and he's in a really bad way and we need to do a blood transfusion urgently. Is there any way you'd be able to bring Maisie in?
Sure, not a problem. I'll be on my way now.
Amazing, thank you.
It only takes 10 minutes for Nathan to arrive with Maisie.
Yeah, all right, you're gonna be a good girl. I know she's just a young girl. Do you reckon she'll stay still for this, or...?
I don't know. I'm gonna have to think it's a bit of a struggle, but we'll go.
So a bit of sedation is probably the way to go?
Yeah, I think so.
Okay, hello, baby. It's great that Nathan has allowed us to take the blood from Maisie. She's a big dog, so she can give us the volume that we need, and it's just so important for Charlie that he gets this blood transfusion. It's really the only chance that he's got for survival. Something like that. Hey, yes, I think so.
Okay. Okay, come on, calm down.
So calm down, Maisie, come on.
Poor Maisie, she's still really young. She doesn't know what's going on.
You gonna let me do it? Oh, Maisie.
It's so hard to see your dog so stressed, but you know it's for a good cause, and if it can help save Charlie, then it needs to be done.
This is coming out very fast, nicely actually. She's obviously got good blood pressure. Nice, big, healthy young dog. Mate, you're a generous soul for doing this, or should I say Maisie's a generous soul for doing this. She might save a life doing this.
She's done all the hard work, eh?
Charlie has touched the hearts of everyone here at the practice. He is such a beautiful, sweet-natured dog who's really been through hell and back with all the conditions that he's suffered of late. Charlie's owners are some of the best. You know, they really are great people. And like anyone, they deserve a holiday. But right now, they're thousands of miles away trying to make a decision about their dog that they love, who's in our clinic right now fighting for his life. And I'm sure their hearts are breaking. All right, sweetheart.
Scott, Charlie's crashing. I need you now.
Okay,
At the Richmond practice, Scott's desperately trying to save 6-year-old Charlie. The Wheaton Terrier collapsed earlier today.
The chest is starting to fill with fluid. She's filling with fluid. I mean, she's bleeding out. She's really not looking good.
His family is on holiday overseas.
Yeah. Get the crash box. Charlie's condition means that he has absolutely no platelets. So that means he can't clot blood. He is bleeding from absolutely everywhere. He's in real grave danger and we need to give him this blood transfusion now.
So we just got to go with it.
Anything is better than nothing, surely.
Okay.
It's in, okay.
It only takes a few minutes for the transfusion to take effect.
There's definitely improvement in that colour. There's no doubt about that. Charlie was starting to deteriorate quite rapidly. His breathing was getting more and more laboured and his colour was getting worse and worse, paler and paler. So thankfully, we've managed to get the blood transfusion into him just in time and he is responding.
It's just a waiting game now, isn't it, I guess? It's gonna do its job, I hope.
Yeah, well, yeah. We just have to give it some time and see if he manages to survive long enough for his red blood cell count to be replenished. But who knows how long.
If we can get that up, we may have a chance.
We've literally done everything we can do for Charlie now. There's nothing left. All we can do is hope that he makes it through the night. I just have no clue as to where this is going to go.
I know.
The next morning, Emma is on her way to work early. After yesterday's emergency, Scott finally ordered her to go home to get some rest. Now, she has only one question on her mind.
Hey.
Morning.
How is the boy?
He didn't make it.
Oh, you're kidding.
No. Yeah. The news for Charlie isn't good. Sadly, he passed during the night. He battled hard and you know, everyone just worked so hard with him, but he was just so unwell, desperately unwell. And yeah, he slipped away in the night. So, yeah.
I'm absolutely heartbroken to hear that Charlie's passed away. Yeah, I don't have many words at the minute. It really sucks.
Yeah.
And you do so much and you try so hard. He's left a hole behind. And it's, yeah, it's gonna take us a while to get over his passing, because he was a special boy and we're all gonna miss him.
Done our absolute best. Yeah. I know.
Sucks.
It's very hard to break the news to Emma that Charlie had passed. She put in such an amazing Herculean effort to keep him going until I got into the practice and was there by his side constantly. She's devastated that he's passed on. Well done. Well done.
He was a brave boy until the end, as he was with everything that life threw at him, but he tried his best and he fought hard. And I just hope now he's in a better place.
Hello.
Hiya.
Hey guys, how you doing?
Yeah.
Oh, thank you.
Thank you.
Bit of a rough day.
Yeah.
Just sucks, you know?
It can't just be your veterinary knowledge that makes you do this job. It can't be. You've got to have a level of compassion. You've got to feel it right in here. Poor Charlie. He's had a lot going on and a lot going wrong, sadly, but he flipping fought, you know.
Oh,
he went as
didn't
long
he?
as he could.
He really did.
He did everything he could. He just got a bit tired.
Yeah.
They're your friends. They've become your friends. You get to know the cats, you get to know the dogs, you get to know the rabbits, you know. You get to know them all. And then when it doesn't end how you want it to end, it crushes him, of course it does. He's only human at the end of the day, you know what I mean? He's a pretty decent human, but he is only human, you know, and he's got a heart as big as anything.
Cup of tea to Charlie.
Yeah.
To Charlie.
Thanks, Matt.